and welcome to Spotlight on Bensenville. My name is Annie Jaworska, Village Trustee, and your host for this episode. Today we will be discussing the opioid crisis, prevention, treatment, and recovery, and crisis response. And today we have Dr. Aaron Weiner. He is the Director of Addiction Services with Linden Oaks Behavioral Health. Welcome, Dr. Weiner.
Thanks for having me, Addie.
Thanks for being here. So can you just tell us a little bit more about your background and the work that you're currently doing?
Absolutely, yeah. So I'm a licensed clinical psychologist. I got my doctorate at University of Illinois downstate. Actually grew up in the Chicago area and really happy to be back here now. I did a bit of my training in the VA and was previously at Grand Rapids before I came here. And right now I'm the Director of Addiction Services at Linden Oaks. I oversee the functioning of our addiction treatment clinics in our 4 outpatient locations, our detoxification unit at the hospital in Naperville, and then also some over our residential program up in Arlington Heights with Northwest Community Hospital.
Okay, so you're very involved, very busy, overseeing many different programming, different sites, and also very involved in the community, I'm sure.
Yes, absolutely. And I work a lot also with Edward and Elmhurst Hospital on the opioid epidemic, which is, I know, our main topic for today. It's something that we see in our clinics, it's something that we're seeing in our emergency departments, and it's really, I'd like to say it's something we should get out in front of, although at this point it's kind of already here, so we're really trying to do everything we can to prevent the spread of it while also treat the people who are suffering.
Right. So can you just tell me a little bit more about, what is the importance of talking about opioid addiction and how does that impact the community?
Yeah, well, so talking about it is of the utmost importance. So stigma and the feeling like you can't share if you're even taking them in the first place, with which a lot of people feel uncomfortable telling their family members that they're taking opioids because of the stigma around it, or if they're having an addiction problem. People don't talk about it nearly as much as almost any other health condition or even behavioral health condition. We're talking a lot more these days about depression. We're talking a lot more about anxiety. We're not really talking about addiction. And the problem with that is then it can grow in secret. And if it grows, it can get worse to the point where someone could overdose, or at the very least, someone's suffering for a long period of time when it could be treated earlier. It's a treatable condition, but if you don't get help, for a lot of people, you get stuck into a cycle that's very hard to get out of.
And why would that be? Why would opioid addiction, why would that be secretive? Is there, like a stigma surrounding addiction, or specifically opioid addiction?
Very much so. So addiction in general is extremely stigmatized, and we have a lot of research to support that. People don't like to seek out support from others because they feel like it's a shameful thing to do. It's something that we've labeled in this society as a moral failing, which is inaccurate. It is absolutely, there's a neurochemical part of this, there's a psychological component to this, there's really a lot to it. But because people feel the judgment from others, they also judge themselves pretty harshly and tend then not to share it. So it's something where when they keep it secret, though, what you hear stories of is, a mom or dad walks in to find their college student dead on the floor. They had no idea that this was even going on, and they're these heartbreaking stories. And that's the end state. This is something that had been growing for quite some time, and had we been able to prevent it earlier, that wouldn't have happened.
Right. And so now it seems like it's more kind of in the light. It's out, it's more talked about now.
Yeah.
And why would that be? Why is it more kind of, why is there an opioid epidemic currently? It sounds like this has been going on for a very long time.
Yeah, well, there's different facets of it. So people have been dying from heroin for a very long time, but unfortunately, just the truth of the matter is that a lot of the people who were dying were in the inner city. And so much like gun crime and violence there doesn't necessarily make the papers there, which is a huge social justice issue, we weren't really hearing about it. So that's been going on for quite some time. Part of what's going on now, though, is that it's been creeping out more into the suburbs. It's been creeping out into places where we didn't see it as much anymore, and it's accelerating. Part of it comes from heroin, but part of it also also comes from prescription pills. So
Okay.
physicians actually, for a very long time, were told that they were under-medicating pain. And pain was actually made called the fifth vital sign for a long time. There was a lot of attention put on it, and actually pain scores were tied to physician reimbursement. So they were being compensated essentially for treating people's pain. And what that led to was a huge shift in people prescribing more and more and more opioids. And as that started happening, we started to see more and more overdoses, more and more addiction, more and more admission and treatment. That actually peaked in around 2015. That was when really the messaging started to get out and started to come back down again. But in the meantime, we have a number of different issues that have come up. Some just are chemical dependency in and of themselves. Some of it has to do with the way we view pain treatment. So a lot of people don't realize that pain treatment does not mean you're totally numbed out. It means actually a 30% reduction in pain and a restoration of functioning. But because we feel like we can't feel pain, I mean, obviously you don't want to, but because the expectations are different. In the United States, we actually consume about 35 to 40% of the world's opioids, even though we only have 5% of the world's population. So there were a lot of factors that led to this. You probably also have heard there were a lot of lawsuits about this with Purdue Pharma. They were pushing OxyContin very heavily in the late 90s. They actually only stopped marketing it directly to physicians, I think, earlier in 2017. But they were saying things like only 1% of people will become addicted if they use it, which was just untrue. That's why it was something like $600-700 million lawsuit that got settled. But there were just a lot of messages being sent out of prescribe these extended release opioids, prescribe, and that's led us to where we are now.
So now in the suburbs, what are some statistics that you're seeing? Are there, what does that look like in terms of opioid addiction here in the suburbs? Are there suburbs that are currently struggling with opioid addiction more than others? And what does that look like?
Yeah, well, there's different ways to look at it. Some of it has to do with overall rate, and then others have to do with growth rate. And unfortunately, DuPage County, where Linden Oaks is located, actually is growing at a faster rate than Cook, where you'll see obviously more cases of opioid overdose just because of the population size. But we're growing faster. Our coroner actually, Dr. Jorgensen, has done a lot of work around this, publishes statistics every year. Some of the unfortunate trends that we're seeing actually is not only have more people been overdosing, but we're seeing more fentanyl in the folks who are in the morgue. So fentanyl is an opioid that's about 1,000 times stronger than heroin, and what we're seeing is that dealers are starting to cut it into the heroin so that
to make it even stronger.
To make it even stronger, but because small amounts can be fatal, they're miscalculating, or users are miscalculating, and that ends up with them dying. What we're seeing is that the number of overdoses are going up in a pretty dramatic fashion, and that corresponds again with the shift to seeing more fentanyl. We have seen a lot of Narcan saves, however, so you can reverse an overdose with Narcan. Naloxone is the generic name for that. And if you add on the saves onto the amount of people who have died, it's a very staggeringly high growth curve. I guess another statistic worth mentioning, there's a couple. So Illinois is a lot higher than the national average for the growth in emergency department visits for overdoses. So nationally, in the last year, there's been a 35% increase, according to the CDC, in emergency department visits for overdose nationally, which is still a lot, right? Up by 35%. But Illinois was actually 65%. So it's a particular issue here. And then a little more on the front end, talking less about the overdose and just about the habit-forming nature of these substances. The CDC put out a study about probably 8 months ago now, looking at the likelihood that someone will still be taking these opioid painkillers 1 year after or 3 years after they get them for the first time. And what they found was that if you have just 1 day of opioids, 6% of people, so about 1 in 20, will still be using them a year later. And 3% will be using them 3 years later. Take that out to 10 days, it goes up to 1 in 5 will be on it a year later, and 1 in 10 will be on it 3 years later. And if you go out to 30 days, and this is pretty common after surgeries, if you go out to 30 days, 1 in 3 people will be using them 1 year later, and 1 in 5 will be using it 3 years later. Those are strikingly, shockingly high numbers for something like this. and there's no reason to be on an opioid that long postoperatively.
Right.
There's just
Right.
no reason.
So what are we doing about this? What can people do if they're noticing that they're taking this medication a year later, 2 years later, and they're realizing after a while that, hey, I'm addicted to this medication? Is there treatment options? What can people do about it?
Mm-hmm. Yeah, well, so on the front end, and this is something that we're working on a lot at Edward Elmhurst Health, which is what Edward, Linden Oaks, and Elmhurst hospitals belong to, the network, is we're really messaging out to both our patients and our providers that we need to talk about addiction and it needs to be a safe thing to do.
Right.
So we're asking people, we're giving them information on what does addiction feel like, what's going to go on, what are you going to experience if you're fostering a chemical dependency, and if that starts to happen, talk to your doctor about it. And then on the other side, the physicians need to know that does not mean you just cut somebody off and kick them out, because that's always the fear. If someone's got an addiction, is that they're going to be cut off and left without a solution, and that's going to be worse for them. And I guess as a little side note, that's how a lot of people make it to heroin. So a lot of people start with pills, they lose their supply for whatever reason, and they have to go to the street. And heroin is a lot less expensive than pills are because it's less safe, honestly. Because pills always have to come from a pharmacy one way or another, whereas heroin can be produced in a lot of different places, smuggled in.
So very easily accessible.
Yeah, and a little more palatable these days because more people are snorting it. So injection, is something that for some people is a bigger jump, harder bridge for them to cross, but snorting is a little more palatable for people to start on. So they'll make their way over to that because it's less expensive, and because it's easier entry now, and then they'll escalate and end up overdosing.
So the first step would be for someone to see their primary care physician, see their doctor, and discuss openly what's going on, how they're feeling. With the medication.
If they're being prescribed it, absolutely.
Okay.
You can always talk to your primary care physician about whatever issues you're experiencing. If you know you have an addiction, though, and you identify with that, you can certainly just call Linden Oaks or another addiction provider directly. We can help people straight from there. You don't necessarily have to go to your primary care physician first.
Okay.
But if you have pain, for example, and you've been prescribed more and more over the years, or if you have any health concern, your primary care doctor is always a good first place to go.
Okay, wonderful. Well, thank you, Dr. Weiner, and we'll be back right after this short break.
The Water's Edge Aquatic Center is conveniently located in the Redmond Recreational Complex in Bensenville. The Water's Edge is home of Fenton High School and Wahoo swim teams, featuring an indoor 8-lane lap pool and diving well. The Aquatic Center is available for private functions and parties. Learn to swim, stay in shape, or enjoy recreational swimming year-round at the Water's Edge Aquatic Center.
The Bensenville Community Library, serving a community of readers. Whether you're old or young, a lover of words, music, or computers, the library has something for you. Check out our new Kindles, toddler jams, story and movie nights, or a variety of other activities offered. For more information, call us at 630-766-4642 or check out our schedule on the web at benlib.org. The Bensenville Community Library, celebrating 50 years of library service.
and welcome back to Spotlight on Bensenville. My name is Annie Jaworska, your village trustee and your host for this episode. Today we are discussing the opioid crisis, prevention, treatment, recovery, and crisis response. And I am here today with Dr. Erin Weiner, Director of Addiction Services at Linden Oaks Behavioral Health. And Dr. Weiner, you mentioned this a little bit earlier today. You discussed that Edward Elmhurst is really taking on a new protocol in terms of requiring doctors to prescribe differently. Can you tell us a little bit more about what Edward Elmhurst is doing with that?
Absolutely. So what we've done is we've created a comprehensive set of guidelines, both generally that we'd like all of our physicians to adhere to, as well as specifically for care environments. So I worked with physicians from primary care, OB-GYN, surgery, the internists in the hospital, or the hospitalists rather in the hospital, the pain clinic. We really went all over so that each service line could feel ownership over the changes that they wanted to make and hold everyone accountable to. So there's different things that each of them are doing, but they're all looking essentially to cut down on the amount that they're prescribing for acute pain needs, and then also work to lower the dosage that they're prescribing for chronic pain, or look to other options.
Okay, and with that, is there how are patients feeling about that? Has there been a shift in how they're feeling in terms of getting a lower dosage for their pain medication?
Yeah, that's a really tricky question. I think a lot of it has to do about how it's presented, but there's always anxiety. If, say, you've been on a high dose of opioids for a while and you feel like you need it to function, there's a lot of discomfort on everyone's part because the physicians are actually responsible for putting you on that. So in some ways, they have to say, well, I made a mistake, which is a difficult thing to do, or this is, I've done something wrong here, and then we have to go through this slow process of tapering you down. And then additionally, while you're tapering down, you will experience more pain while you're coming down. So because opioids are a habit-forming substance, you develop a tolerance. So people who are on these high doses will actually experience roughly the same amount of pain on much lower doses, or to be honest, on no opioids at all. However, as they're coming back down, their body has to adjust, and while it's adjusting, you will experience more pain. So it's oftentimes something that's very distressing, and unless the physician does a very good job of explaining why what's going on is dangerous, why it's not sustainable, why it can't continue, people can oftentimes get very angry, and even if they do understand, oftentimes there's a lot of irritation, to say the least, because in the short term, and by short term I mean potentially months, you will be experiencing more pain than you did before.
Okay. And in those situations, are doctors also offering like different, treatment resources, such as, connection with a therapy to kind of to process the pain that's going on, as well as the addiction component?
Yeah, absolutely. So if people have pain, and many of them do have legitimate pain, you are ideally moving them towards healthy, sustainable options, which is what opioids are not. But absolutely. So actually at Elmhurst Hospital we have an integrative care clinic where we have acupuncture, where we have a mindfulness practitioner, we have Reiki therapy there, things, particularly acupuncture and mindfulness, that have a lot of evidence base, and Reiki is good as well, but things that you can do instead of the opioids. Additionally, we've launched a lot of educational measures for not only our pain clinic physicians, but also the rest of them, that tell them about other options that are out there, things like injections that you can get, TENS units, or electric stimulation that you can use to reduce pain. Cognitive behavioral therapy and mindfulness are two therapies that can work. Physical therapy, of course, certain muscle relaxers. There's actually even been a study that's been very widely promoted by the National Safety Council, which is an organization based actually locally out of Itasca, that's been doing a lot of good work on this, that shows that for many people, taking both Advil and Tylenol at the same time, as long as you're medically okay for these substances, can be just as effective as hydrocodone, which is the active ingredient in Vicodin and Norco. So there's a lot of work to be done in a lot of different areas, but having options available when someone comes down on the opioids, it's critical.
Right. And it sounds like Linden Oaks with Edward Elmhurst Healthcare, it sounds like that you guys are doing a lot to help with this, to offer patients different options to help overcome this issue. I think that's wonderful. Dr. Whiter, can you tell us a little bit more about the Illinois Prescription Drug Monitoring Program? What does that look like, and what is that exactly?
Sure. So the Prescription Drug Monitoring Program is a state-run database, and every time you pick up a prescription from a pharmacy that's a controlled substance in any way, Schedule 2 through 5, and that includes things like stimulants like Adderall, Ritalin, opioids, of course, any of it, even benzodiazepines as well, things like Ativan, Valium, Xanax. It's sent into this registry. And if you look, and anyone with a license to prescribe can look. So those are dentists, those are physicians, the people who are writing most of these scripts. You can see every prescription that someone's picked up in the last year. And what that means is that if someone's been going to multiple physicians and picking up different prescriptions, or been getting medications that you weren't aware of from another physician that could interact with an opioid, you can see that immediately, and you can talk to them about what's going on and alter what your plans were to prescribe. It's an incredibly useful tool for clinical decision making. Unfortunately, historically, only 1 in 5 physicians in our state have actually looked at it ever. Which is a massive underutilization. And so actually there's been a law that was passed towards the end of last year that necessitated all physicians now to be registered for it by, I believe it was January 1st. They had to be registered. I believe within 1 year they need to provide evidence in their notes that they're consulting it before every opioid prescription, so that they're looking at it. And I think within 3 years, every health system has to have this a portal to this database built into their electronic medical record. That's actually something that Edward Elmhurst Health did. We're one of the earlier adopters. I think we're one of the, certainly the first 10, maybe the first 8 to have it in the state, where a physician doesn't even have to log in. It's literally just right there in the chart. So when you're looking at the patient's medical record, you just click a button and you can see their prescription record as well.
And that's helpful to also keep the physicians all on the same page. So if one physician is prescribing a medication and then this patient is seeing another physician months later, that physician can see what the other physician was doing.
Right, yeah, and that's, so sometimes it's completely unintentional on the patient's part, where they're going to one person and getting, say, Xanax from them, and then they're going to another one for the opioids, but those actually interact and can lead to a much quicker overdose if you're not careful about it. And so it's critical that those lines of communication are there. And we don't share medical records amongst different offices just by default, so we don't have an easy way of sharing. This is a really good workaround for that, or at the very least, you'll know what someone is getting from pharmacies, and you can double check it that way.
Okay, great. And I know that Linden Oaks offers many different types of programs, different behavioral health services, and one of those is the medication-assisted therapy clinic. What is that? What is that all about? How does it work? What are the components of this program?
Yeah, that's a really good question. So when you're getting over an addiction, it's a very, very challenging process. And actually for painkillers, for opioids, it's even harder than a lot of other substances. 90% of people we found in research will relapse in the first year after treatment if they don't get some help with medicines. And so medication-assisted treatment is using one of 3 primary medications. That's methadone, Suboxone, which is a brand name for buprenorphine is the active component in there, but Suboxone is what you hear most. And then naltrexone, which is usually called Vivitrol, or often called Vivitrol. That's if you get in a shot. Each of those medications can essentially make it so that you won't go into withdrawal. Methadone and Suboxone in particular, you don't go into withdrawal. If you used a substance, you wouldn't get high from it. You wouldn't feel anything. So there's really no point in that sense as well. And you don't have cravings. So that physiological pull that people who are addicted to a substance feel, they don't have when they're on these substances. And what we found is that people are much more successful if they use these substances as they're in their early recovery process and finding other ways to deal with their pain or with their emotional distress, whatever's going on, and they're on it for a period of time. And so we opened a clinic where you can get it for that long period that they oftentimes need, generally months and sometimes even years.
Okay. And with the clinic, is it just medication, or is there also a therapy component with that as well?
Yeah, well, so one of the differentiators actually of our clinic is that we require people to be going to therapy while they're there, to going to group therapy. So if you're just giving someone medication, you're not treating the psychological side of an addiction and the social side. A lot of people, when they're having addiction problems, have either cut all the healthy contacts out of their life, or they're surrounded by people engaging in the same unhealthy behaviors as they are, drinking buddies or other people using opioids. And so if you don't address those things as well, your ability to cope with emotions, the psychological side, as well as the social, those things oftentimes will pull you back. And so we have a model where when someone comes in, they're in the clinic for about 2 hours, and in that time they meet with their medical provider and they get their medication, or their script for their medication rather, and then they also engage in this group therapy, which we view as critical for someone actually recovering from addiction and then not staying with us forever.
Sure. So it sounds like the therapy component and the medication component together, really someone will see the best results with both of those.
That's correct.
Wonderful. And if someone is motivated and they want to stop using opioids, what would be their first steps? What could they do?
Well, honestly, if you'd like to stop, your first step is to reach out for help. And that can, again, be Linden Oaks. You could call us, another addiction provider, primary care, and develop a plan. It's very difficult to just stop cold turkey because you'll go into pretty severe withdrawal, depending on how much you take. You can. Actually, opioids, as terrible as it feels to withdraw from them, it will not kill you. It will just be like the worst flu you've ever had. So it's possible to do that, but it's oftentimes very uncomfortable. And what people tend to do instead is either go to a detoxification facility like Linden Oaks, or you could just start in a medication-assisted therapy clinic like ours or another one, and switch over to these medications that then allow you to come off of it in a much more gradual and safer fashion. So, for example, if you were using heroin all the time, you could come in for an assessment, and then after you complete your assessment in the clinic, come back the very next day to get onto Suboxone. You would basically just have to stop using heroin for 24 hours, which can still be uncomfortable, but then you come back in 24 hours, you get onto Suboxone, and then you can start a slow, gradual taper while you're also building up skills to deal with whatever it was you were coping with the heroin, and rehabbing the rest of your life as well.
Okay. Wonderful, Dr. Weiner. You've been so helpful today. This information is so valuable, especially to our community. And, thank you so much for joining us. And this has been very enlightening and helpful.
Thank you for having me.
Thank you so much. And be sure to tune in next week for Spotlight on Bensenville.